Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. Today I wanted to talk to you about some options for cosmetic dentistry. At my office, we don't have a very pushy, salesy approach to anything. I just basically ask you if there's anything you want to improve about your smile or you have concerns with. And if you say no, fantastic. And if you say yes, I can go over all the options with you. Common cosmetic dentistry services would be Invisalign or lighting of the teeth, whitening, or veneers. So those would be kind of the things that come to the top of mind. But any smile makeover, really any dentistry should be cosmetic dentistry. We always want to mimic the shape and size and form of the tooth unless we're intentionally trying to improve it. So whitening would be one of the cheapest, easiest ways to do that. You can use over-the-counter products. We have professional options that are a little better for you. We have in-office options, we have take-home options. So very cost-effective way to brighten the smile. People who smile are more confident, they're more successful. So, I tell my staff, remember guys, we're changing smiles and we're changing lives. So there's a lot of great options. So if it's just that teeth have gotten a little darker over the years, you just want to do some whitening, great, we can do that. If it's that there's mild crowding or rotation, I'd recommend Invisalign or clear aligner therapy. So there are a number of different clear aligner companies. They're all pretty good. Invisalign's the one everyone knows, but we also do regular orthodontic therapy. Orthodontics is a cosmetic procedure, but there are functional benefits too. So the bite, the jaw relationship, the airway, but just confidence, making the teeth easier to clean for your own care, preventing gum disease long-term. So there are a lot of benefits of improving the smile in addition to just, the cosmetics of it. I always recommend Invisalign or whitening before trying to go to something like veneers. Veneers are basically half of a crown. Sometimes they can be done without drilling the tooth at all. Sometimes they can't. So anytime we're bonding anything to the tooth, I always like to tell people, even if it's fantastic work and it lasts 20 years, at some point it's either going to need to be redone or something's going to come off. So I always encourage people to have their natural tooth with whitening or orthodontics and Invisalign. But some people don't want to go through the time of that, or there's discoloration that just is beyond that, or they've already done that and they're still not happy with where they're at. So all the stars you see in Hollywood, most of them, that's not their teeth. It's veneers, it's crowns. So porcelain products that have been bonded to the teeth to make the smile look brighter and whiter. Great option for a lot of people. If you're interested in it, I'm happy to do it for you. Do a lot of cosmetic cases at the office. There's a lot of great labs in our area. And some dental technology has really improved in the last 10 years, and that you have a lot of different options for veneers now. A lot of different things are being done prepless without drilling on the tooth. So there are a lot of great options for veneers. So those would be some options for crooked or crowded teeth. What about age-related cosmetic procedures? So up to the age of 12, your child's jaw will still be developing. We want to make sure it develops properly with orthodontics, functional orthodontic therapy, things like that. But we want to wait until your child's an adult or finished growing before we start looking at doing anything that would be additive to the tooth beyond orthodontic treatment. So veneers or something like that, you'd want to wait until the 12 to 18 range, depending on the child and when they stop growing. No one's too old for cosmetic dentistry. Most of my patients who go through Invisalign or orthodontic treatment are in their 60s. Cases have been done routinely up to about 90 years old. So, it's never too late to invest in yourself or improve your smile or do something that you feel like is going to make your life better. Any procedure that would involve preparing the tooth, drilling on the tooth would involve anesthetic. A lot of cosmetic options do not, so they're not painful. Sensitivity is common with tooth whitening. Orthodontics doesn't really cause much pain or discomfort nowadays. If you hear somebody talking about that, it's probably from 20, 30 years ago when too much force was put on the teeth, excessive force that wasn't helpful in moving the tooth, but just caused some pain. But if we are doing something, crowns or veneers, that involves drilling on the tooth, of course, will get you numb, get you comfortable. Cosmetic dentistry is typically not covered by insurance. So I have about 1,500 patients, about 50 of them have an adult ortho benefit. So for most people, it's not covered. They never cover whitening. Some people do have an adult ortho benefit. If you have questions about that, give the office a call. My whole front desk staff is there to help you out with questions about insurance. But veneers, they're never going to be covered. Now, sometimes we need to do a crown tooth for decay or other reasons, and that would be. So if there's a medical need and at that time you want to improve more of the smile, that's a great time to do it and use that insurance benefit. We do have financing options available at the office. So most of our financing companies do interest-free for a year, or we have third-party financing companies that'll finance out like 5 years. So let's say you want to do $10,000 worth of treatment. Probably be way more than what you would need for most cases. You maybe be looking at $250 a month for 5 years on something like that. So we try to give people options that are affordable to them. If you have any questions about cosmetic dentistry, you want to consult, you want to look at something, you have more questions about anything we went over at this video, please give us a call at the office, 703-451-4500 or dulacdds.com. Thank you, and I look forward to seeing you in the office soon.